Hi, I am Farissa Cooper, and today I will be talking to you about the 60-second assessment. What can you do in 60 seconds? You can smell a flower, kiss a child, you can pay a bill, you can send a text, you can land a job, you can lose a job, you can change someone's mind in 60 seconds. However, if you're a registered nurse, you can do so much more. In 60 seconds, you have the ability to save a life. This is an important fact that members of TCAB discovered in June of 2006 when they were trying to think of ways to transform nursing care at the bedside. Deborah Struth was one of the main initiators of this initiative. She wanted to transform care at the bedside by developing a partnership between practice and education. They were at UPMC Shady School of Nursing, and there the pilot program began. Excuse me. Basically, what the 60-second assessment tool is an assessment tool that every nurse can use every time she enters a room. Basically, it's used when you initially enter a room to give you a guideline of what to look for in the first minute that you're in a patient's room. You assess them from head to toe, from level of consciousness to PIV infusing, to whether or not they're on O2, whether or not there are safety concerns, and basically you assess all of this in the first minute. By doing this, you can save a life because you have the potential to see things that could cause harm or risk to your patient when you first walk into the room, therefore giving you the opportunity to change them, adjust them, or do whatever you need to do to keep the patient safe. I retrieved an article from the American Journal of Nursing with Deborah Strutt, and she basically outlined how it came to be, how this tool was taught to the instructors and then tested with the students at hospitals, and how the levels of satisfaction went up with the patient care managers after they saw the students actually putting these tools into practice. There's also another reference that I'd like to mention with Amir, Quality and Safety in Nursing book 2010. On page 14, the actual tool is listed there for print or download for people to use. If I were to teach the tool, I would actually have students look at the tool, then go into the room, come back with their assessment finding, and then compare what I saw with what they saw in an effort to help them strengthen their skills. The 60-second assessment tool goes beyond the initial assessment. It's something that you do when you walk in the room initially, but it's something that you should do every time you pass by or have any contact with the patient. Before giving the medication, it only takes 60 seconds to check the ID, to verify medications, to make sure the patient is swallowing it. When you start an IV medication, it only takes 60 seconds to ensure that it's infusing so as to prevent a delay in patient care. There's so much more to the 60-second assessment tool, but it is something that's being used worldwide, and it's something that needs to be continued as we move to a better quality of health care and a safer condition for our patients. Something that every nurse should use every time. Thank you.